set us apart in birth injury cases.
Elk and elk, every client, every day.
Ohio's governor and leading children's hospital officials today made an urgent plea to schools: make kids wear masks.
And they did this because the governor says the data proves that COVID cases are higher in districts where masks are not required. 13 ABC's Willie Danley has the story live at 11 tonight. Willie.
Lee, according to the governor's office, there has been a 2,000% increase in cases among Ohio children. And according to Governor DeWine, every school district is red hot with COVID cases. Hospitals are saying steps need to be taken immediately for the children's sake.
As children's hospital leaders and medical professionals, it's incumbent upon us to speak out and say what we know is the best thing for kids. And the best thing for kids right now is for them to be masked in school, all of them.
Today, children's hospital leaders, including ProMedica's Russell J. Bide Children's Hospital, held a Zoom call with superintendents. They spelled out the grim numbers for COVID cases among school-aged children and pleaded with superintendents to require masks for all staff and students.
How Children's Hospital's ability to care for all children is being compromised. If a child is too young to be vaccinated, then until we get through this, we need students who come to school to wear a mask.
Patty Manning is the chief of staff at Cincinnati Children's Hospital.
Our inpatient numbers are the highest they've been during this entire pandemic for COVID-positive children. Our ICU numbers are the highest they've been for this entire pandemic. Our children on ventilators with COVID are the highest they've been during this entire pandemic. That impacts the care of all children, not just children with COVID.
Since August, the state says almost 30,000 5 to 17-year-olds have confirmed and probable cases of COVID. This past week, Ohio saw a 44% increase in cases among school-aged children. And school districts where masks are optional saw higher case rates among kids. Manning says we have two choices.
Almost twice as many children test positive for COVID, not quarantine, but actually have COVID. Some of them will get very sick. Some of them might die. They will overwhelm our healthcare systems, and that will affect the care of all children in Ohio.
Or she says we can embrace the science that has been proven to work.
Wearing a mask is not dangerous to your health, as you've heard. And these tools minimize people getting sick, minimize children getting ill, having long COVID, minimize the strain and the burden on our healthcare system, and allow kids to stay in school.
While Governor DeWine made it very clear that the state legislature would not allow a health order mandating masks to pass, he says he will not give up and is hoping that after listening, schools will adopt the mask mandate for the time being. Reporting live, Willie Danley, 13 ABC Action News.
All right, Willie, thank you. Well, the NBA reportedly not going